Welcome, 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 welcome. Thank you all so much for agreeing to participate in today's panel. We appreciate you saying yes, because I know that you have very valuable information to share with individuals that give supportive services to our Indigenous extended family. And so thank you again for saying yes, and thank you again for your service and the contribution that you have made during the COVID-19 pandemic. The COVID-19 pandemic highlighted health inequities across the nation and in Wisconsin. We know that it's been hard on everyone, but the data shows us that Black, Indigenous, and other people of color have been disproportionately affected by COVID-19. These inequities are reflected in vaccination rates, and many of the factors that contribute to health disparities may also be barriers that prevent people from either getting vaccinated or healing properly from the infections. As the data shows that white populations have higher vaccination rates, individual choice is not what keeps communities from being healthy as possible. In fact, we know that structural racism and other social factors create barriers and obstacles for many people. Health is influenced not just by our access to quality healthcare services, but research shows it's also impacted by where we work, where we live, and how much money we earn, and the education level that we've attained. It's our hope that during this time that some of your answers will begin to give a bigger picture or a clearer picture of some of the barriers to vaccination, and then some of the experiences of Wisconsin Native Americans, Indigenous folks, and during the pandemic. And so with the spirit of that, I'd like to launch into the questions that you all were sent ahead of time, and have you just share some of your experiences. All righty. So first of all, and I will call you in the order that you show up on my screen. I'd like for you all just to tell me a little bit about the demographics of the people group that you're a part of, your sphere of influence, and then perhaps where you serve. And Candy, you're first on my screen. So would you introduce yourself and perhaps where you work, and then just some information about the demographics of the folks that you serve?
Sure. My name is Candy Cornelius. I am from the Oneida and Menominee Nation. I am here as the prenatal nurse at the Oneida Clinic. Some of the people that I service are pregnant, expecting moms, breastfeeding moms, and infants. The clinic the IHS Travel Clinic that I work at is open to all Native Americans. So we don't only see Oneida enrolled. Oftentimes we'll see tribes from all over the nation. Enrollment for Oneidas is 17,000 enrolled members. Mm-hmm. Not all live on the reservation. So the population here at the clinic, like I said, could be from all tribes. And I think that's about it.
That's great. Thank you so much for your sharing. Next on my screen is Josephine. Josephine, would you introduce yourself, please?
I am Josephine Webster. I work for Wise Women Gathering Place. I am a sexual assault domestic violence advocate, and the population we serve is primarily women throughout the Green Bay Fox Valley area. Right now we have about 3,500 clients. So yeah, thank you.
Excellent. Thank you so much for your service, and thank you for agreeing to participate on the panel. And then on my screen last is Miss Alice. Alice, would you mind sharing who you are and where you've worked?
Sure, I would not mind. Yeah, it's good. Good how you put it. I recently retired, so I have worked at some place. I retired recently from Wise Women Gathering Place. I am actually from the Lakota Ojibwe Reservation near Hayward, Wisconsin, but I'm married to an Oneida, and we moved back to his home country in 1992. And I have 6 children, and I'm retired at the age of 74 after working 27 years as a home birth midwife and 24 years as the director of Wise Women Gathering Place.
Wow. Thank you so much for your service. Just excited to have you and the wealth of knowledge that you bring with you on this panel. So thank you again for saying yes. So you all were sent just a list of questions or possible questions. And so as we know that sometimes we don't follow a specific order, and that there is some organic information that comes out that's really rich. And so just know that I may just ask some things that weren't on your list. And I trust that you are able and competent in being able to answer them. So thank you so much again for being here. And so the first question I'd like for you guys to answer is, how did you experience the invitation for vaccination? What factors contributed to your response or the position you took on vaccination? And so let's start from in the middle. So Josephine, would you go ahead and start us off with that answer, please?
So when the vaccination first came out, I was really skeptical. I wasn't sure. Actually, I was sure. I didn't want to do it. There wasn't enough research. I felt like it was just way too soon. But there was other factors in my family that prevented me from really making a choice. My son was in kidney failure. In order for him to get a kidney transplant, we all needed to be vaccinated in our home before the hospital agreed to give him the transplant. So it was kind of one of those things where, although I didn't want to do it, it was either that or he wasn't going to get the kidney. So we decided to all get vaccinated.
Wow. Wow. Thank you for that. You know, in the 4, I've done 3 already. And then there were some times where people made the decision because they had to, based on eligibility for other medical services. Thank you for sharing that. Candy.
So as a healthcare professional, I was just saying the pandemic came around. We all were notified March 2020 that this virus is coming through, and kind of got all hands on deck. My primary duties were prenatal education and support. Everybody was needed, so I was quickly trained in what actually COVID was and the precautions that we were going to take here as healthcare professionals, masking. And later on, we had found out that the vaccine was going to be mandated for healthcare providers. And with the research that I got, and we were receiving trainings, so I kind of seen the data, the research behind it, and felt comfortable. So I was one of the first to be vaccinated in December of 2020. It was the healthcare staff and the teaching staff. And then going forward, it was providing a consistent message and information to community members and providing the information and the vaccine. We did mass clinics at the elementary school. And then to this day, we're still doing small clinics here. So it's just providing, and answering questions to community members and being available, to get vaccinations.
Sure. Thank you for that. And then Miss Alice.
Well, for me, it was a little bit different because I'm kind of I guess what you would call an anti-vaxxer. And I did not vaccinate my infants. I had 6 children, and I did not because one of my younger brothers, when I was a child growing up, received his 3rd set of vaccinations as a healthy infant and was dead within 24 hours of that vaccination. It was never admitted that he died from the vaccination. They said he died from pneumonia, but my mother said he was fine, that he didn't have anything, and so that stayed with me all my life. I just thought, well, I'm not going to inject my brand new infants with these things because maybe we have a special susceptibility to that. And I don't want to, I will take my chances with nature. And I did that. As my kids got older, they made their own decisions about that. And most of them have gotten vaccinated. But yeah, I didn't do it. And those are the reasons why. And the other thing is that now that all my kids are grown and old and have kids of their own and stuff, is that one of my sons, who is a police officer in Las Vegas, what him and his wife signed up to be members of the study, the placebo trial testing of the vaccine, and they didn't know which one they got or whatever. And so my son really encouraged me to get that. He said, "You're old, Mom. You gotta, know that it's harder on older people. You gotta get it." And I really fought with myself about it, but I decided to go ahead and do it. The other thing that concerned me was that I've never seen them develop a vaccine that quickly for anything. And that led to a little bit of mistrust for me, that they just flopped something out there and told us to take it, hoping it would work. So that's my experience.
Thank you. Thank you for that. I appreciate you guys sharing that story or that information. So Sheila Walsh, she was an entertainment personality in the maybe 25 years ago, and she had mental health issues in her family background, and she started to experience a mental health strain. And when she told people, they told her not to tell anybody because it would tank her career, that she would never work again in the entertainment industry. And so she was on a broadcast, or a live broadcast, and she walked off the set, and then she went and checked herself into a into a mental health ward. And the positive was that she actually got well and then became a prolific writer, has written a few bestsellers. In one of her books, she says that sometimes God gives you gifts that when you open them, they make your hands bleed. And so I have been referring to the pandemic as one of those gifts, because it was really difficult, and it was a gift. It was a gift in disguise in many ways, but it made our hands bleed, and more so for some people than others. And so the question that I have for you is, what gifts did the pandemic provide you that you may not have received or grown from any other way? If you can think of the pandemic as a gift, what gifts did you get from the pandemic that you wouldn't have received any other way?
I got an answer.
Okay.
I like this question a lot, because I thought, that really has happened for me, at least for my view on the world, I guess. But one of the things that happened as a result directly of the pandemic is that I think the conversation has changed somewhat in our cross talk between agencies and service people and government and just community, is that instead of just accepting that some people are just poor because they don't want to get with the program and stuff, it's becoming more realistic to see that there was definite structural things that were put in place to take things from specific people, and to refuse to let those same people participate in the same way. Couldn't get house loans, couldn't get good jobs, couldn't get address, zip code, where it was more desirable and so forth. And people are starting to see that that's real, I think. And the other thing that is just a singular thing is that at Wise Women Gathering Place, we were able to see the need for, at the time of the pandemic, when everybody was so concerned about everything being spread, and don't put everything in a box, and don't touch it, and wear gloves, and wear masks, and stay 6 feet, 8 to 10 feet. The sneeze will go 20 feet.
Right.
We were warned about all those things. And what happened was that we right away, I mean, the pandemic was announced in March. By June, we were up and running with a safe parking place for up to 20 cars.
Wow.
Safe distancing them. We had porta potties for them, because there were people that were not able to go to their normal friend's house or relative's house to sleep the night because of the fear of the pandemic being spread. So they would sleep in their cars, and that was being the police knocks and all the different things. People who live nearby or think you're a nuisance and tell you got to move. So we provided a safe place where people could sleep through the night, and we also gave them other services. And in so doing, the blessing of that was that there are people who live in their cars. We
Mhm.
did not really know this, because
Mhm.
there were some people who had been living in their cars for a long time, and
Right.
they, there is a need for safe parking places.
That
And
is
that
great.
we're the only one in Wisconsin so far that I know of. And I think we better put some more there because there's a need,
Thank
and
you
that's a
for that.
blessing.
Yes, yes. And thank you for your service. Thanks for your willingness to kind of operate outside the box and make that available. Thank you.
Mhm.
Candy.
So this was a hard one for me because I've been here since day one. So it's kind of, I don't want to say nothing really has changed, but I come to work, I'm helping people. What changed in my particular work was just how I delivered services. I used to go to homes, I used to go to hospitals, and all that had to stop due to restrictions. So it was really kind of brainstorming. I found out here that our team really got together. It's called emergency preparedness, and we had to get together and use things that we were trained on, but never really thought we had to use. We
Right.
trained in the emergency preparedness. We always take, e-learnings and talk about it. And it just like a flip of a switch, everything fell into place. And it was like all those years we were learning all of this and it never really made sense to me.
Mhm.
So obviously that consistent training was a blessing in disguise because we knew right what to do. Our team was fabulous, pulled together what we needed to, got the vaccination clinics. We were trained in how to do contact tracing. Everything just kind of seemed to fall into place. And then on a personal level, I just, and like Alice had said, was really struck of how many families greatly struggled in this pandemic, and still to this day. My parents, I couldn't even do the education because they didn't have a place to live, or anything to eat. So responding to that was just, being grateful of the things that I had, like, Alice said, like a roof over my head, and, just trying to help others and with resources and things. And then I think from the tribal perspective too, as a nation coming together and providing all these Facebook Live technology was literally a blessing in disguise. Also, being able to go on Facebook Live and anybody can pull up their phone and kind of chime in, and it was consistent, on time, in real time education and promotion about what things were going on. So
Mhm.
I guess those are the kind of the takeaways.
Thank you. Thank you for that. Thank you for that sharing. So what one thing do you wish more government and health officials knew about the populations that you serve related to vaccinations?
Honesty and transparency would be my response. I think even in this pandemic, it was clearly demonstrated that the messages that came out were sometimes self-serving, sometimes they were outright incorrect. Like
Uh-huh.
a mask isn't going to help you, a cloth mask won't do anything, or you heard different things from the authorities
Mhm.
about those things, and setting up that confusion to be was
Mhm.
not worth it. Was not worth it. If they needed to save the N92 masks for our healthcare professionals, I believe that our country would have said, okay. I mean, because what I did when I first heard about this, I went out and I bought vacuum cleaner filters, HEPA filters, and made masks. And they
Uh-huh.
were the most uncomfortable, hard to breathe in masks you ever tried, but I would have done that for the healthcare providers, so that they who put themselves in the most immediate danger from this would be able to be protected to whatever extent we can. I mean, I
Mhm.
just think that if you're just honest and transparent, we'll help you with the solution. We got lots of geniuses in this world and
Mhm.
different people that'll take steps to try and help.
Thank you for that. Thank you, Alice, and thank you for your service. Oh, excuse me. Thank you. Candy?
We were getting information, obviously, from the government, from CDC, DHS, you know, officials as far as the information that was available to people. But I'm glad most of the tribal communities took a different route in providing their own education and awareness of the COVID vaccine and the disease. So we had, say, community members, tribal leaders, even cultural leaders kind of stating, why are you getting vaccinated? Or tell me your story about COVID. So each tribe, I think, took their own personal mission to have a personal twist to it. Because like Alice said, there always has been a lack of trust in what the government instructs us to do, the information that they provide us. So most of the tribal communities use their own tribal members to make announcements and provide education. But what was I going to say? The information when COVID first hit, there was tons of webinars. I needed to know how I could service my population best, and it was quite devastating that in other amongst other tribes that Native Americans women were pinpointed. I think it was the Dene, if they delivered and were a certain zip code, their babies would be, removed. They thought removal, if mom has COVID, take these babies away, they're going to get it. So those huge, racial inequities were seen in the hospitals right away. I mean, we were kind of, I guess, and these were the things that I was learning and people were learning from. We heard this was going on in this particular tribe. It's not needed. They were telling women to do certain things, but a lot of that was that, you have a tribal reservation next to, say, a major city, and that major city already has, some racial discriminations against natives, and then they're thinking our rates are high, so they're mistreating, that population in the hospital. That's unfortunate. That in any other thing, high rates of diabetes, and then pandemic hits, and then they still are mistreated. So that was unfortunate that those types of tribes weren't protected against those inequities within the hospital.
Wow. Thank you for that information. Josephine.
So at the time of the pandemic, I was actually working in a psychiatric hospital. And if I had one thing the government should know is that the mental health really suffered from COVID-19, people losing their jobs or not having, adequate food or places to go because they lost their jobs, so they lost their homes. And we were filled to capacity almost the entire time of when the pandemic was at its worst, because so many people were coming in, suicidal and, just ready to give up because they didn't have the means to, make it through this time, because nobody was expecting this to happen. So when it hits you, how do you handle that mentally? And a lot of times we had to let people go because of their lack of insurance, and we had, there was situations where people left and they did commit suicide because they didn't have the insurance anymore. Turning people away because of that didn't seem fair, because, it wasn't, they were, firefighters and, just different people in the community that, had jobs and had security up until this point. So it, was really disheartening to have to see that happen so many times because of the pandemic.
Wow. Thank you. Thank you for that. Oh my goodness. And there are just so many hidden from in plain view inequities and just gross injustices that happened in many communities, and a lot of people they don't have a clue that then people were operating under the strain of the coronavirus, and then also just this exaggerated racism that they were experiencing. Wow. Thank you so much for sharing that. Okay. You guys have alluded to it just a little bit, but a lot of misinformation floated around during the early stages of the pandemic in particular. How did you get your information, or where did you go to get information that was accurate and reliable? Josephine, would you start?
Sure. So a lot of the information that I got was directly from the hospital itself, because we everything was constantly changing. So you'd see something on the news and then you're like, is that real or is it not real? Or should we be worried or not worried? You know, when the pandemic first hit, one of the nurses that I worked on the wing with, her and I got a hotel room for like 2-3 weeks because we thought, hey, this is going to be over in a couple of weeks and we shouldn't go home because we have high risk, you know, health people that live in our home. And we didn't know where to go to. You know, it was almost like you hated to turn the TV on because you weren't sure what they were going to tell you next. So I had to rely heavily on just, you know, what the, you know, our bosses and our bosses' bosses were saying, because it could almost send you into a panic.
Yeah.
Not knowing who to believe.
Right. Wow. Thank you for that. Candy.
Yeah, I would have to agree. The information and updates were very fluid. We met on a daily basis. Like I said, our emergency preparedness teams kicked in. There's different branches. We had people who were doing contact tracing. We had people who were doing, you know, the vaccination. And then we had to figure out how to protect patients, how to protect ourselves. So it was a huge organization, and we needed to meet daily. I was involved in one of the reports that had to be sent out weekly. And it was, looking to CDC and DHS for information and just staying on top of it every single day.
Wow. Thank you. Alice.
Well, I was on vacation in Las Vegas, Nevada when it hit, and we stayed in our rooms and we were glued to the television. We were watching the ever rolling maps of the world and how the pandemic was spreading, and what they were saying about it. And I mean, a lot of it was with watching also from the CDC, whatever they put out, we were glued to that set, and we managed to escape to a plane and get home earlier than we had been scheduled to, just because I called to see if there was any planes going that we could get on, and we were lucky, so we did, But I mean, all the way through, I heard them saying, asserting things as fact that I think really they didn't know for sure was absolute fact. And I think that's what I mean by transparency and honesty, is state what you think as like an assertion with humbleness, so that we know that maybe you don't know this for absolute sure, because we don't know some of the things that we consider to be facts. They're really not facts. They're just the current knowledge right now. And we've known current knowledge to change when we found out something else that we did not know. So I think it would be better to just be thinking like that and not consider it such a need to be the absolute authority on everything.
Right.
Ever.
Wow. Thank you for that. Thank you guys for those answers. They're really just enlightening. So I have a question. Did you have a specific moment when you realized that you could actually die if you caught COVID? When was it? And then what did you do after you realized that?
I can go. Like I said, the COVID information is not my expertise, but I dove myself into webinars and got trained. So I was doing contact tracing, which is calling those that tested positive, explaining the procedure, quarantine, and, providing a lot of education. And I found myself getting really immersed in these families' stories. They're my community members. I knew them. So call an individual, who's in your household, what are your symptoms, how are, a lot of times it's a huge extended family. So I had called this gentleman, and he had his fiance and her children and then their children. So I'm going through this whole list and asking them how they're doing and if they had a medical complication to get tested and how they're doing. So it was really me inside their homes kind of, and, you know, hearing some of them who were really ill, some who were really isolated. A lot of the elders were like, thank you for calling me, you know, can I take a walk? Or, yeah, I'm not sure when somebody can stop by to give me food, or, you know, things like that was just really eye-opening and, you know, kind of heartbreaking. And I did have at one point, one of my clients had passed away, and that was hard. He was a community member. And then also hearing throughout the course, people my age, you know, passing away, 40s, who had, you know, complications and things. So I guess that was it for me, dealing with families who were in the midst of it. And then on a personal level too, when my family got COVID and I couldn't go into the home and help them, it was a really, really hard time. To see my family be affected by it, and, you know, just being scared for them, and that feeling of helplessness. It's like I couldn't go in the home, I couldn't help them. So yeah, it is, and it's, you know, had been a really hard time.
Right, right. Wow, wow. Thank you for that. Anybody else? Was there a moment in time when you realized, oh my goodness, I could die from this, you know, and then how did you deal with that?
I don't know if I had such a moment, because I just didn't think it would be me. I just never thought that. And besides that, I just thought kept putting whatever my purpose of the day was in front of me, and I just did the day. I didn't, you know, and sometimes it was when we were like staying at home all the time, you know, it was that too. But my family came home. All my family has had COVID at least once, most of them several times. And I've stayed with them and taken care of them, and I never got it, or at least I never knew I had it. I've been tested like 9 times, but it's always been negative. But they don't really test you to see if you had it, because there's
Right.
no benefit to that or something. And, you know, so I just kept thinking of putting the purpose of the day in front of me and going like that. That's how I lived my life like that, really.
Wow. Yeah. Thank you for that. Thank you for that. Josephine?
So I think for me, it wasn't more so like I could die from it, but I'm thinking my son who was in kidney failure, like he could really die from this, you know. We've spent the last 16 years of his life trying to keep him alive and make sure he was healthy and things were, you know, clean and sterile. And we were really, you know, cautious about everything he did. And then it all come down to, you know what, he could catch this virus and it could take him out. You know, it was really eye-opening. And, you know, it was like at one, you know, he had gotten really sick and time was, you know, dwindling down for him. And a kidney wasn't coming. And I was like, what do I do? Do I let him live life, or do I leave him in the house and, you know, shelter him there because I'm so afraid he's going to get this virus? Yet, like I said, I worked in the hospital. So me even coming home every day was a risk for him to get it. So I guess for me, it wasn't more so me, but it was my son.
Wow. Yeah, I just think it's fascinating to hear just like the different perspectives, and to recognize that people were existing with so many different levels of complexity of how they were interpreting the experience and that kind of thing. So thank you all so much for sharing that. So I am wondering, people talk a lot about accountability, that somebody has to be accountable for this, and somebody is responsible, and all of those other things. What did a conversation about accountability mean for you as it related to the COVID vaccination? What did the concept of accountability or being accountable mean to you?
For me, it always focuses back on the possibility that someone from our country may have funded this to happen. I just feel like there's been the story told that was true, and it's been challenged. We've seen it I mean, I kind of watch these things when Congress is in session about something that I'm interested in. I'll sit up and watch it and listen to what they're saying and take notes and the things like that and discuss it with other people, and I just feel like there's at very least a reasonable doubt that this was an accident and that it may have been I forget what the term is. It's a good term to describe it, but I can't think of it right now. But it's about uh, letting it leak and to see what happens, I guess.
Wow.
And seeing it go all over the world like that, even if, and also, you hear stories now about the numbers that are so large of people who got it and people who died. But then when you compare it to other diseases, it's not that much larger, if larger than some of those other things that people do die of. And so I'm wondering if there's a manipulation happening there. I mean, things like that always go into my head because of the history that where it always happened.
Wow. Sure. Thank you for that. Candy, what about you and accountability? What do you think about when you think about the accountability as related to the vaccination efforts?
A loaded question. Like I said, I wear many different hats. When we first heard of the pandemic, when we started actions in March, it was through some literature that I read that actually the USA had some inclination in December, January, that this was about, or it already had occurred. So I would kind of question that we, could have maybe got a better jump start on this if they were to have informed us earlier. Kind of like Alice said, there was some hidden information, and as far as when it was made public to us. So that always is like, when I talk to people who were sick, say got it right away in April, May, June, they were like, I remember being so sick in December and January. That's probably when I had it, so, and we weren't tracking anything then.
Right.
So where's the accountability in that? We weren't testing, we weren't counting these as COVID deaths. So that is kind of a wonder to me. I also think about going forward in a pandemic, self-accountability. As a healthcare provider, I need to be accountable to myself and to my patients and to the community to stay on top of information, to be vaccinated, and to be here to answer questions. So that's.
Wow, thank you for that. Thank you, Candy. Josephine.
So I guess I never really thought about holding, like, who's to be held accountable. I do agree with Candy saying that, if this would have been put out there a lot sooner, maybe this pandemic wouldn't have been as severe, or maybe there would be more documentation, maybe not so much as severe, but more documentation of accuracy. I know that my oldest son had came back from California like in November, and he got really sick. Like, I was back and forth to the doctor all the time, and I kept saying something's wrong, and they kept saying, no, it's, it's just a flu. And I'm like, no, this is way more than a flu. Like, they were giving him shots just to try to get it to go away. The antibiotics weren't working. So yeah, I definitely believe that there could have been more communication early on.
Wow. And I remember in November, the year before the pandemic was declared, I remember saying, man, there are more people that have had pneumonia than I have ever seen in my life. I remember that there were just tons of people that were getting really sick and several people that had pneumonia. And I think that it was probably connected to the COVID-19 pandemic. Wow, interesting. That's really interesting. And it's interesting that you all in your community zeroed in on that. And that's a different response than some of the other panels. And so it's just fascinating to me listening to all the different people groups and what strands of communication and conversation were happening amongst them. Thank you for those answers. So, We talked already about gifts that make your hands bleed. And I want to ask a related question. And I want to ask if you could briefly share what you feel like you've learned during the pandemic.
I can go. So I have learned to just take everything as it is and not worry so much ahead, because when the pandemic happened, it kind of like made you live life every single day, you know, just taking for granted the fact of being able to go home and, sleeping in your own bed, because some of us didn't get to do that in the beginning, and just really enjoying family. Because I know that for us, when I was home, because I was in the hospital a lot, I was working like 80 hours a week. It was crazy. I barely got to see my kids. But when I did, I thoroughly enjoyed being home and just taking in the moment and being able to be out in nature, and things slowed down a lot. We couldn't just run to the store and hang out in the mall if we wanted to. And being able to do that, I think, brought this whole different sense of peace in a time of chaos, if that makes sense.
Wow.
But yeah.
Wow, thank you for that.
I'll go. As healthcare providers, we're always taught, self-care, or in any, teachers or any different profession is, make sure you take care of yourself. We've always been told that, but wow, self-care was totally needed during the pandemic. Just looking into it and going through it. I started running in the middle of the pandemic. So stressed, anxiety's high, for my community, for myself, for my family. And it was, we were getting articles of how, to take care of yourself. And it sounds so easy, right? Self-care, but we as Native American women, it is really hard to make time for ourselves. It is. So mine was in the form of exercise, and our team here did a really good job, our community health clinic, as far as keep an eye on us. And, in the beginning, it was, all hands on deck, we got to go. And as nurses, we just go. That's what we do. We take care of people. But looking into what causes stress is being put in and doing tasks that you're not normally doing. So for me, I was used to, on a positive note, providing women, congratulations, you're pregnant, welcome to the new world. Here's me saying, heads up, you only can have one person, preparing them for almost like the worst case scenario in the hospital. When life is supposed to be beautiful and supposed to be shared, I'm preparing them for a really, kind of bad situation. And, like Josephine said, really being grateful for everything and everybody around you. But being put in situations where I'm having to do COVID tasks and it's not my normal tasks was, increase in stress. And even though I was able to do it and, completing my tasks. So just think of everybody having to put on, we wear so many hats as healthcare providers, but, wearing that COVID task hat was very stressful.
Right.
So self-care was the takeaway and definitely was needed. And if any organization or a group of people that, didn't participate, probably severely suffered. So I was grateful that we were able to, take care of ourselves and make it a point to.
Wow. Yeah, sure. Thank you for that. Thank you for that. I have just two more things. And some of them you've answered, some of them more completely than others. So I'm just attempting to extend some of these. Okay, so we know that the pandemic took a toll on many different communities, but we also know that in particular, the Native American community was hit very hard, losing just a tremendous number of elders across the United States. In addition to the loss that it's difficult to recover from in terms of losing griots and losing history and losing some of the things that ground a community, what are some of the emotional, mental, and physical realities that you, as a member of the larger Native community, experienced throughout the pandemic? Anyone?
What are some of the, what?
What are
Larger,
some of the emotional, mental, and
Right.
physical realities that you experienced throughout the pandemic? In terms of the
Oh,
toll that it took on you and your community?
well, one of the things I think is it took us from each other. I just feel like that was such uh, an awful experience to have people who would ordinarily, like with where we worked at Wise Women, we had clients coming, we had people calling, people meetings that we were giving and presenting and attending, where we known community, we could look each other in the eye and discuss something through, and everything changed. You know, we couldn't come to each other, and I think we really, as far as like the workforce, I think we missed each other badly. We even
Mhm.
had to hire people during this pandemic, and they got to start their career there in isolation
Uh-huh.
from any of us. You know, we couldn't have that kind of community fellowship that helps us find our way through difficult things. You know, we just you know, it was very bad. I did think of that term too. It was gain of function, where they kind of I think, maybe I'm wrong too. I don't really know it that great, but I know that it was something about some of the virus being leaked, whether deliberately or on purpose, in a way just to see if it would then make us more immune or make us sick, or what, you know, what it would do to us, you know, just kind of curiosity thing,
Mhm.
kind of irresponsible
Mhm.
if that
Mhm.
happened. So thank you.
You're welcome. Thank you. Others.
I would have to say isolation was a huge factor for many of the community members. Just not wanting to or being able to go out and about as they normally would. In Native communities, you often hear it takes a village.
Mhm.
So it takes a village to raise a child. And I think it takes a village, end of life also. So I have a lot on both spectrums. Like I said, women giving birth without that village around her to help her. And then end of life scenario. The gentleman that had passed away that I was taking care of, not even having his family being able to be around there. So I don't think we've seen the true end result yet, because these people haven't been even able to grieve appropriately. Funerals were put to a halt. Our traditional ceremonies were put to a halt. So those are slowly beginning to, um, restart. But I know a lot in the school age. I see my nieces and nephews, having to do virtual for that half a school year, and then so they're talking about that whole population of the youth being, where are their social skills? How are they going to interact with their peers? Some of these kids, were probably better off in school than, say, in a home alone. So
Right.
I think a lot of these things are still coming to surface, and I'm quite fearful for the peer or for the youth.
Uh-huh.
There's going to be a huge academic gap. Mental health is a priority here in Wisconsin. A local school got a grant to provide mental health first aid training to all staff, which is excellent. So it's teachers kind of being able to notice if something is wrong and how to intervene, because I think if we're just at the tip of it, we haven't seen the true effects.
Sure, I think that you're correct about that. And I believe that there will be this just windfall of research that will be conducted, trying to connect some of the impacts to the time that we were in isolation and just were guessing at what the best way to care for our young people was. Josephine?
So I think for me, I feel like the disconnection, you know what I mean? A lot of our families on the reservation are very close. You'll ask somebody how many people are in your family and they'll tell you 150, because they're including everybody, aunts, uncles, cousins, a lot of us spend our, birthdays and different celebrations, Christmas, whatnot, together, and we weren't able to do that. And having to learn how to be okay with just our immediate family. It was like heartbreaking because we wanted to get together and we couldn't, like Candy said, we have ceremonies that go on. We weren't able to do that for the fear of, spreading the virus. And it was interesting because my son and I had attended one of our ceremonies a couple of days ago, and he goes, "Mom, I know this sounds really corny, but it felt so good to be in there." And I was like, "Yes, you're right, it did." And he was like, "I feel like a part of me is back. I feel like it's been gone for the last few years." And I couldn't understand, like, where did this emptiness come from? But when I got in there and I was able to participate and we were singing, like, it just felt so good. So, the long-term effects are still there. As far as the school thing too, having to self-teach, the kids having to self-teach pretty much. I give every school teacher out there a lot of credit because I had to try to be a teacher and I was like, this is not for me. But, kids being like so secluded and not having that social interaction and just, we talk about kids being on the internet all the time and, not playing with their friends or being in groups, kind of how it was, years ago. And it was like we forced them into that. And now trying to get them back out of that is kind of difficult. But yeah.
Wow. Sure. Just a ton of information, right? And I think it's interesting how differently different people groups kind of were experiencing some of the same things. And I guess it depended on them. Their starting point was different, right? And that's the beauty and the challenge sometimes with diversity. We have just about 7 minutes left, but I wanted to make sure to ask you all, was there anything else that you wanted to share before we get off of the time together? Then would you all like to share anything that you wanted to say, that you thought of, and because this is a good time for that.
I got one thing. I was just going to say that we do, I think it was kind of, magical. All the heartache and tragedy was there. And that was very, very hard. But also I think we did experience some magical transformation in ourselves that we got to see in real time about how we can deal with and adapt to situations. Because in this process, in this last 3 years, we went from having a 5-day indoor kind of a ceremony type experience that we did with community members for healing from trauma, from generational trauma and forgiveness, learning about that and unresolved grief and different things like that. And we totally took that and made it virtual. And in that process, we always provide the medicines and different things that you might need for that time together. And we used to take those supplies to people, and it was another set of people. I mean, yes, some of the same people were there, but I personally delivered supplies to people who were literally shut-ins for many years, not having anything to do with the pandemic, who just, I ended up staying there for 2 or 3 hours every time I went, because this person just literally didn't have anybody to talk to. And it was such a good thing for that person to have somebody there to talk to. So I did it. And
that's one of those.
That person revealed to me that, thank God you guys did this, because if you hadn't done this, I would never have been able to take this. And it's helped my life.
That's pretty wonderful.
Yeah.
That's another one of those gifts that we just wouldn't have had if the pandemic kind of forced our hand at that. And so that was a change that we wouldn't have considered making, we didn't have to. Thank you for sharing that. Candy or Josephine?
I just want to, and I had stated this before, was real happy to see and not surprised that all tribes came together, did their own promotion, and anywhere from tribal leaders, community members, educators, nurses, there was just this huge unification of people and, to keep each other safe. So, each tribes, I know throughout Wisconsin, I know all the other maternal child health nurses also providing information to their clients and trying to keep them safe, promoting the vaccine. We had commercials, we had Facebook Live, we had interviews. We submitted a COVID success story. We actually had we call them stand the van. We were able to purchase a van and go from site to site to offer vaccinations to different employees. So just a really great group of people, I think, in each nation just coming together and providing what they need to protect their community.
Yeah, that's really nice. Thank you for that. Josephine, did you have anything?
So I think the biggest gift from COVID was just learning how to slow down and embrace the moment, whether it be in your family or your job or in the community, like just slowing down. You know, we were forced to do that. And a lot of us run on this like minute by minute scheduling where we're constantly on the go and we don't get to enjoy things because of our time limit that we're on. And with everything happening, it just seemed like maybe that was the creator's way of being like, okay, you know what, world, you're not slowing down, so I'm going to do it for you. And, you know, like Candy said, just being able to get out and run, like, who thinks that that's going to be something that you're going to really enjoy doing, right? But you do, because you're like, well, this is all I have. And you know what? I got these legs and I got these lungs and I can do this. So I think there was a lot of gifts that came with it, and learning how to adapt. You know, we adapted to whatever scenario we were given, and we all succeeded because we're all here, you know. So it was a blessing in disguise, I feel like.
That's great. Thank you for that. Yeah, we are still here. And so that is fantastic. And I am so grateful to you for saying yes to this, but then grateful to you for your service. So thank you so much for your service. And time does fly when you're having fun. And so our time is up. And I want to just tell you all that we will have an opportunity to put all of the meetings like this together. And we are planning to host a webinar, like a mini conference day, where we just go through all of the different communities that were represented and share these broadcasts. And then we will provide links to you, and then hope to get a plan together so that you can broadcast it so that other folks that would benefit from this information will be able to attend. So thank you all. If you need anything from me, you have my email, my phone number, please reach out to me. And I look forward to the next opportunity that we have to share just some of your wisdom and some of your lived experience. And so thank you so much and have a good day.